Retractions. In this module, you will learn to recognize chest retractions. The objective of this module is to recognize retractions as a sign of pediatric respiratory distress. Let's first take a moment to understand what is meant by the term chest retractions, which is also known as chest indrawing. Note that in the following videos, we use these two terms interchangeably.
The baby's breathing appears fast. Also, notice the mild chest indrawing. This commonly occurs in a baby with fast breathing. Distinguish the mild chest indrawing that is normal with fast breathing from severe chest indrawing, a sign of serious illness. Notice, as this baby draws a breath, her lower chest sucks in deeply, and her belly appears to move out. Our baby does not have severe chest indrawing.
As we saw from this video, chest retractions range from mild to severe. In all cases, the child's soft tissue covering the chest is pulled inward due to increased work of breathing. This typically occurs if the upper airway or lower airways of the lungs are blocked. As a result, you see indentations of skin and soft tissue, which are signs of respiratory distress. Now let's take a look at the different types of chest retractions. Retractions where the belly meets the rib cage are called subcostal retractions. Retractions between the ribs are called intercostal retractions. And retractions above the sternum are called suprasternal retractions. Retractions often start in the subcostal and intercostal areas. Retractions tend to progress upward. Children in moderate to severe respiratory distress may have suprasternal retractions. Now, let's take a look at what retractions look like in a few more patients. Here we see arrows pointing to subcostal retractions. Here we can see retractions, suprasternal retractions under the neck and above the sternum, intercostal retractions in between the ribs, and subcostal retractions where the belly pulls beneath the rib cage. This child also has intermittent nasal flaring. You can see this by looking at the child's nostrils. We will cover nasal flaring in the following module. Let's observe retractions in older children. What kind of retractions do you see in each example? So the main takeaways are, first, retractions are a sign of respiratory distress. Second, retractions are the inward movement of the chest wall when the child breathes. Third, look for subcostal, intercostal, and suprasternal retractions in children with respiratory distress. And fourth, it is important to recognize respiratory distress and intervene, or help the patient, before the patient reaches respiratory failure.